So I was a stay-at-home mom, and then I decided to go into nursing. About 8 years in, started having some issues, but as a nurse and a mom, always put yourself last. I was convinced that things would go away if I lost some weight. And through that journey, I had expressed that I was having some left-sided pain into my arm, and that bariatric surgeon said, "We need to look at your neck first." Hi, my name is Ilisa Diamond. I am a mother, I am a wife, I am a nurse, and I'm a dog lover. So I was experiencing terrible pain from my middle of my arm down to my fingers. As a nurse, it was very challenging because I was already starting to lose some dexterity, which was very important in my role. I never once thought that there was something going on higher up that really could be life-threatening. It was the first time in about 12 years that my husband and I had a trip planned, and I met Dr. Estin, and he said, "You need surgery immediately." And I said, "I want to go on this vacation." And he said, "I'm telling you, you shouldn't, but I understand where you're coming from. You need to be really careful." So I did, and I had surgery the day I came back. That was surgery number 1. It was about 2 years later. I woke up with a spasm one day, and it just went severe. I called Dr. Estin, and I was in terrible pain. He said, "Meet me at Monmouth Medical." Christmas Day, he opened up the OR, and that was surgery number 2. So after the 2 neck surgeries, I was fine. I've been working all of these years, started with some lower back pain. You were able to still get along with life, and you were able to manage, but chronic pain affects you. And you don't realize that it affects your sleeping, it affects your mood, it affects your relationships, it affects everything. And over the course of like 3 years, the pain just was getting worse and worse. And I started not being able to stand for very long periods of time. I wound up leaving a career that I loved as a floor nurse to take a leadership role because it allowed me to not have to stand on my feet for 12 to 14 hours a day. And I kept making excuses until I couldn't even fold laundry anymore. I couldn't go to the supermarket and make it through a store anymore. I knew I couldn't ignore it anymore. So when I had the MRI with the orthopedist, he said that there were 2 issues. At that point, he said both surgeries could not be done at the same time. The thoracic needed a lateral approach, which he was not comfortable doing. And that's when he told me to go back to Dr. Estin. As a nurse, I never even knew anybody that had thoracic surgery because it's a very delicate region and really poses a lot of risk, including paralysis. I was expecting my first grandchild. That was my fear, that I was not going to be able to take care of her and take care of myself. When I went to Dr. Estin, he explained this is going to be a 2-step approach. We need to do the thoracic first because that's the dangerous one. And we're going to let you recover, and we're going to see how you do. Then we can address the lumbar. He wanted to make sure we exhausted all these other opportunities because the recovery from back surgery is not easy. Everybody told me you need to go to the city, you need to go to hospital for special surgery. That's where the best doctors are. I didn't even go for another opinion anywhere else. That was it. I needed surgery. He was the doctor to do it. 4 weeks after the last back surgery, I was offered an opportunity, and they waited for me to be cleared by Dr. Estin, and I'm back to a job that I absolutely love. I'm just so grateful, so appreciative. I get to see my family. My granddaughter lives in California. I can sit on an airplane and be able to go visit her and pick her up and go on the swings with her. If anything should ever happen again, I have no doubt that I would come back to Dr. Estin. He gave me my life back.